Now, the U.S. disease control body has warned that the current Ebola outbreak could scale up in the absence of strong public health interventions. The US CDC Center for Forecasting and Outbreak Analytics warned that the ongoing Bundibugyo outbreak in the Democratic Republic of Congo could reach or exceed the scale of the devastating 2014 to 2016 West Africa epidemic. The eruption of the virus resulted in more than 28,000 cases and more than 11,000 deaths. The U.S. projections from the Centers for Disease Control and Prevention were part of a morbidity and a mortality weekly report documents published Friday. The agency said worst outcomes could be avoided if a larger proportion of patients were identified, isolated, and treated. If isolation levels are what the CDC would consider poor with no other interventions, there is a 65% chance cases will top 20,000 within 3 months. And according to the agency, the CDC manager for the Ebola response said the situation on the ground would indicate levels of isolation that are currently on the lower end. On Friday, the World Health Organization and the African Union's Public Health Agency said $518 million was needed across the next 6 months to combat the outbreak in the DR Congo and its neighbors. And according to the WHO's latest figures, there are 381 confirmed cases in the DRC, including 64 deaths. The outbreak has hit 3 provinces, with the epicenter in Ituri, where the Africa CDC says accounts for 90% of confirmed cases and 76% of confirmed deaths. Across the northeastern border in Uganda, there have been 16 confirmed cases, including 1 death. 7 Ebola patients in the DRC and 2 in Uganda have recovered. The workers in the Democratic Republic of Congo have built additional structures at a hospital in Bunia and to meet the need posed by current Ebola outbreak. Officials say an Ebola treatment center was launched a few days earlier, where they were adding almost double the amount of beds, from 38 to 70, to meet the demand. On the other hand, the United Nations warned that intensifying violence in Eastern Democratic Republic of Congo is killing civilians. UN spokesperson has said an armed attack in Beni territory on 2nd of June reportedly killed at least 24 civilians. He said insecurity has already displaced hundreds of thousands of people and cut off more than 165,000 others from regular aid. The UN said the violence could also hinder the response to the Ebola outbreak as humanitarian operations become increasingly difficult.